So yeah, well, I first of all feel put to shame by the amount of work that the pre-docs have done in a year. I am doing my PhD part-time and I'm just starting the second year of that. And I also work as a public health registrar in the other part of my time. So I'm just going to give a brief overview of some of the work that I've done. I'm going to talk a bit about resilience to start off with, and then talk a bit about plan for the rest of my PhD and training. So what is resilience? So quite literally, resilience is the ability to bounce back from adverse events, as you can see here. But in my research, I'm focused on the resilience of communities, so groups of people, not individual resilience. And community resilience is an important concept in disaster prevention. So disasters happen when exposure to a hazard leads to disruption in the functioning of a community or society. And building resilience is really important in that disaster risk reduction policy. And for example, it's part of the United Nations Sendai framework and also our own domestic disaster policy as well. So this is another conceptualization of resilience, so a dynamic process which mitigates impacts to some of those shocks that can happen to a population. And a shock could be a natural hazard like a hurricane or an earthquake, or a pandemic, or an economic shock. And resilience is postulated to be something that facilitates the adaptation to that shock. So you don't just keep getting punched in the face again, but you hopefully do something different next time. But if we can indeed build resilience, then how would we know whether we've done that? And that leads to the core of what I'm interested in, which is how can we actually measure community resilience? Because to know if you've built it, you have to have a baseline to work from. So that's what I'm kind of focused on in my PhD. So I started this work with a scoping review, looking at the literature around quantitative methods for measuring community resilience, and identified 10 different frameworks. In one particular framework, the baseline resilience indicators for communities was the most replicated framework and also the most mature one in terms of how it had been validated. So this is that framework. I'll refer to it as the BRIC because it's really long to say the whole thing. But basically it's a composite index using secondary data sources across these different subdomains that you can see. And the original BRIC had 36 indicators in it, kind of summed up to give it a composite resilience score. And this shows you what that looked like for this initial study area, which is in the southeast of the United States. It's basically a geographical distribution of resilience across those counties, with the areas in red being the ones with lower community resilience. So then went on to do a systematic review because the initial scoping review had identified that the BRIC framework had been applied quite differently in different places. So I wanted to understand that variation a bit better and to look at the methodological quality of those studies. So the systematic review identified 32 studies in the end for inclusion. And the picture on the right here shows the results from the quality assessment. And this was done using a composite indicator checklist, which had 10 steps in it. So going through and seeing, so for example, most of the studies had a good rationale for how they'd selected the particular indicators, but very few gave a good explanation of how they dealt with missing data, for example. So it's just looking at the different dimensions there. So my big next step is to try and develop a community resilience index for England, based on an adaptation of that BRIC framework and using the learning from that systematic review to try and make sure that the quality of that work in terms of the methodology is as good as it can be. But as a step towards doing that, I've created an economic resilience index for England that just used 5 indicators, and I'll talk just a little bit about that. So this is the results from that economic resilience index. On the left-hand side, you've got that at local authority level, and on the right-hand side, you've got that for the regions in England. And certainly in that right-hand side map, you can see that north-south divide. So the yellows and greens are the areas with higher economic resilience, and the oranges and the reds are the lower economic resilience. And I use the data from that index to look at allocation of a community resilience fund, which is part of the government's levelling up agenda. So this was a fund that was available for areas to bid from. And I've compared that to an expected fair share based on the results from that economic resilience index. And what we can see from that is the 3 northern regions in England have the lowest economic resilience, and they also received £21 million less than their expected share based on that economic resilience index. So this now is just a bit of an overview of where I'm up to and what some of my next steps are. So I'm doing my thesis in journal format, so trying to publish my papers as I go along. I've done some training in a master's module in geographic information systems, which is really helpful. And I'm doing a course in Stata as well, which is a software program that I'll be using for analysis, and starting to think about how I can incorporate some patient and public involvement as well in my research, and just thinking about the best way to do that, given that this isn't something that's kind of patient facing, if you like, and it's using existing data sources, but maybe thinking about what would communities think about some of that terminology around resilience, and perhaps being described as an area that was low in resilience. What would that mean to the people living there? So just thinking about some of the ideas around that. So I've submitted a paper now, that economic resilience one that I touched on. That's now been rejected 3 times. So I'm going to go for number 4 this week. And just in the process of writing up the systematic review as well. And then I've got another year after that. Again, I'll be looking at another paper around that for writing that up. But that's just some of my experience so far. And yeah, just say thank you to my supervisors. They've been really supportive around what I suspect will be a long journey around trying to get all of this published, but also really encouraging me with the training as well. I think when I started, my mindset was a bit like, this is about, can I get in the research side of it done? And it kind of felt like when I was doing training that maybe that wasn't part of the PhD, but they've been really supportive in kind of encouraging me to take all of those training opportunities as well. So yeah, that's my last slide, and I'm happy to take any questions. Thank you.
Thank you, Christine, for a really clear exposition of what is quite a complex area that you're doing a PhD in, but an incredibly valuable area as well. I mean, I have just a comment and then a question. The comment I would be saying is, please don't be disheartened by the rejections for publication. Getting publication is hard, and in a research team I was previously in, we used to have a competition of who got the trophy for the most rejections, and I think there were 13. Somebody got 13 rejections. I'm not suggesting you will get that. You will get it published, and it's incredibly useful data to get published, so I encourage you to keep going and don't be disheartened. But my question would be, how do you think that this will map onto health inequalities in any way?
Yeah, absolutely. And I think this kind of comes from the disaster literature, this particular framework. But obviously my background is public health, and there's lots of interest in community resilience from a public health perspective. One of the things that I would like to do is to incorporate health as a dimension within that index that I produced for England. And ONS have actually just recently released a health index as well. So I think there is other, you know, increasingly seeing the use of composite indices for this kind of thing. So I think there will be clear parallels with health inequalities, absolutely.
Oh, thank you, Christine.